Hey everyone, my name is Guus, and today I would like to talk to you about the coronavirus situation here in Sweden, starting from the end of January up to this point, which today it is the 9th of April 2020. Of course it's 2020. I hope this doesn't last much longer than a year. So for those who do not know me, as I already said, my name is Guus. I'm originally from the Netherlands, but I moved to Sweden in August of last year to study my master's here in Norrköping. And I have to be honest with you, I wasn't that worried about the coronavirus at all. I was following kind of the international recommendations, self-isolating myself together with my girlfriend, and only really leaving to do either sports, which is running in my case, and to go to the supermarket or do any other essential shopping. Now, when I did get worried was last Sunday. I was going for my run, and this is a run that I've done on multiple Sunday mornings over the past, let's say, more or less half year. And it was really crowded this Sunday morning. And you would expect that Sunday morning, people go out with their families, go for a nice walk, but not in a crisis time. So this made me very curious about what approach is Sweden actually taking to tackle this coronavirus. And I decided to look into it, kind of evaluate my personal thoughts and perspectives on the situations, and also share it with you. Along with that, the international news has been giving a lot of attention towards the Swedish situation over the past couple of days, and a lot of people from the Netherlands have actually been messaging me, asking me, hey, how's the situation over there? So I hope this video kind of clarifies everything about that. So I will be running through kind of a timeline starting at the end of January and going up to today, the 9th of April. Now keep in mind that I am not a professional, and the main sources I used for finding this information, which is primarily actually the local Swede, which is this international newspaper, can be found in the description. Another thing to note is that my point of reference is the Netherlands, because that's where I'm from. That's most people I've been communicating with, where they are from. So that's my biggest point of reference. So I did type out some of the points that I have to stick to, and I have them on my laptop to the right of me here. So I will be kind of glancing back and forth, following my outline right here, and conveying the information to you. So let's get started. The Swedish coronavirus timeline really starts on the end of January when the first case arises. This is on the 31st of January. And it was a person who had just traveled back from China and tested positive in the hospital in Jönköping, which is actually not too far away from Norrköping where I live. I think about an hour and 45 minutes, but that was the first case. The Swedish authorities reacted relatively quickly, and on the 2nd of February, so just 2 days later, they evacuated all Swedes who were still in China at this moment in time. Then we make quite a big jump to the end of February, wherein the risk level of the virus spreading in Sweden was upgraded from being very low to just low. And almost like the virus heard this increase and reacted to it, the number of cases by the end of February, which is just 4 days after this risk level was upped, increased to 13 in total. For now, all infections were still kind of traceable. So everybody who got infected either traveled from a country where coronavirus was already more developed. Is that the correct word? I guess so. Or it was somebody who was in contact with one of the already known victims of the virus. Then it's time to move on to March, and I'll kind of move week by week from this point on. So during the first week of March, the risk level was upped again. And by the end of the first week, so the 7th of March, it's almost like the virus was listening again to this risk level, and the number of cases increased to 161. Now, of course, I do know that the virus is not listening to this risk level, but I think it's interesting to see that as they update it, the number of cases actually makes quite a big leap. Now, I'm sure there's some coordination going on there. In the beginning of the second week, the number of cases really started rising a lot. There was an increase of 100 cases in just 2 days. So that's on the 9th of March that we are now. This included the first community infection. So what a community infection means is that somebody who does not have any direct links to anybody else who is infected and also did not travel from another country got infected. So this person was just doing their everyday things, going out for walks, doing grocery shopping, and suddenly they found out that they were infected. Because of this community infection, the Swedish government reacted relatively quickly, and the level got upgraded one final time, this time immediately from the moderate level that it was to very high. So they skipped the high level. During this second week, the first 2 coronavirus deaths in Sweden also happened. So that's the second week of March, including the first one in the Nordic countries. Now, as a reaction, the government took a number of measures, making the first day of sick leave from someone's job paid, which is usually not the case in Sweden, and banning all in-person events with more than 500 people. During the third week, my personal university, I got a message that everything went into distance mode, which means that all the lectures until the end of this school year will be taught digitally via Zoom. Now, we do know by now that Zoom is also kind of questionable, but that is not the topic for this video. Now, for the rest, not too much happened during this third week rule-wise. But of course, the number of cases kept increasing, ending up at 1,746, which is an increase of another 804 cases compared to last week. Also, a total of 20 deaths had been reported at this point. At this moment, something got acknowledged as well, and that is especially that for the number of cases, this number could have been incorrect, since testing for the virus was kept to a minimum to maintain resources in hospitals. And then making a slightly bigger jump to the end of March, the number of cases saw a huge leap, counting 4,435 cases of the virus, an increase of 2,689 cases over this 9-day period, so from the third week until the end of March. Now, it is important to remember that the increase from the second to the third week of March was only 804 cases. So we made quite a big jump. On a 7-day period, just a week ago, there was an increase of 804, and now on a 9-day period, there was an increase of 2,689 cases. Now it's time to move on to this month, April, and this is where stuff gets kind of interesting. So on the 1st of this month, a number of binding recommendations were introduced by the government. These capture limits for shops, only outdoor trainings for sports clubs, the familiar, if possible, work from home kind of concept for employees, and just general social distancing and isolation for individuals. Now, the interesting thing about these recommendations is that it's not an optional thing. You have to follow them, but at the same time, you can't get fined if you do not follow the rules. So they're obligated, but if you don't follow them, you won't get punished. And this is kind of a theme I've been seeing with the approach Sweden has been taken. A lot of the stuff is recommendations. In this case, it's a recommendation that you have to follow, but also if you do not follow it, there's no consequences for it. And then finally, just a couple of days ago, on the 7th of April, a bill was approved giving the government the power to quickly make ruling decisions without needing the parliament to approve these decisions. One final thing though, this law is only set to apply from the 18th of April, which is another 9 days, that's more than a week. We've seen the increases over the past couple of weeks. If this only goes in on April the 18th, I'm curious if they'll be in time to really help prevent the crisis. Now moving on to today, the 9th of April, I have a map opened here. So currently in Sweden, let's have a look, there are 8,419 confirmed cases and there's 687 deaths. Comparing that to the Netherlands, there's 20,549 cases and 2,248 deaths. So doing kind of a relative comparison, in Sweden there's 83 cases of the coronavirus per 100,000 inhabitants, and in the Netherlands at this moment it is 120 per 100,000. Now, I have been seeing more and more of an increase in Sweden, so I do have my doubts if the rule that they are using at this moment are actually very effective in flattening this curve. So that is the timeline. Now let me start by saying that from this point on, I am following kind of the international recommendations as well as the Swedish recommendations. I am keeping more of an eye open for those recommendations. And as I already said, I'm just staying out inside, only really leaving to go either for my runs or to go to the supermarket. So as I also just addressed, the Swedish approach seems to be very recommendation based. There's no hard rules or laws, or even if you have to follow them, you don't get fined if you don't follow them. So it's kind of iffy and it's kind of confusing to me, to be honest. And this is especially the case since, based on my own experience, people have been massively leaving the house to go for walks and meet up. For instance, on that Sunday morning, as I was saying, the 5th of April, when I was going for my run, and there was just so many people in the park. And I'm not just talking, families with younger kids. No, I'm also talking old people who are, of course, a very sensitive group for this virus. So I've been kind of confused. Now, let me tell you that I do believe the authorities, and as I said, I'm also following their rules. There's people, professionals working on these rules, and if they think this is enough to kind of slow down the crisis, then I can only believe them. Now, that doesn't prevent me from kind of questioning what they are doing, and maybe with some harder and harsher rules in place, the virus can be stopped or slowed down even more. These types of rules, for instance, are in place in the Netherlands now, and the number of infections and deaths seems to have kind of stabilized. These rules capture actual social distancing. Meeting up is illegal, and you have to keep more than 1.5 meters, or I think in the US it's 6 foot distance, or 6 feet distance in between each other. Otherwise, you might risk actually getting a fine. Now, of course, comparing the Netherlands and Sweden is not perfect. There's some differences in density. For instance, the Netherlands is a very dense country, a lot of people in a relatively small area. In Sweden, it's much more spread out. There's different communities which are connected by highways and railroads. But I do have my doubts if this kind of structural difference with the communities actually has a negative effect on the speed and the spread of the virus. So that is my story for this video. If you have any questions, or maybe you want to start kind of a discussion in the comments, feel free to do so. If you are new to this channel, so am I actually. I've just started creating YouTube videos again. I was kind of feeling passionate, and I felt like this was the perfect opportunity to do so again. So overall, my interests are running and technology. I am hoping to make some videos surrounding those topics. So if you are interested in any of those topics, feel free to stick around by subscribing to this channel. But overall, I would like to thank you for watching this video. Don't forget to like, and as already said, leave some comments, and then I will see you around. Bye bye.